Welcome, everyone. I am honored to be able to say Happy International Day of the Midwife and welcome to ICM's first of two IDM events, Stories of Climate Resistance. Today, we're joined by midwives from different parts of the world who are going to share their inspiring and amazing stories and experience to inspire everybody to work towards improved climate resilience and to helping communities affected by climate change. We are now going to put the Zoom instructions on in English, French, and Spanish.
Welcome to your meeting with ICM. The interpretation button should appear at the bottom of your screen, next to the Share Screen button. By clicking on the interpretation button, you can choose the language you would like to hear. The interpretation button will then transform this meeting into the selected language. To change the language you would like to hear again, follow the previous procedure by clicking on that same button. By default, you will hear the selected language at 80% volume and the original audio at 20% volume. If you would like to mute or unmute the original audio, click on the corresponding option within the language button. Enjoy your meeting. Bienvenue à votre réunion avec l'ICM. Comme la réunion propose une interprétation simultanée en français, le bouton Interprétation devrait apparaître en bas de votre écran à côté du bouton Partager l'écran. En cliquant sur le bouton Interprétation, vous pouvez choisir la langue que vous souhaitez entendre. Le bouton Interprétation se transforme alors en la langue sélectionnée. Pour changer à nouveau la langue que vous souhaitez entendre, suivez la procédure précédente en cliquant sur le même bouton. Par défaut, vous entendrez la langue sélectionnée à 80% de volume et l'audio original à 20% de volume. Si vous souhaitez couper ou supprimer l'audio original, cliquez sur l'option correspondante dans le bouton de la langue. Bonne réunion. Bienvenido a su reunión de la ICM. Como la reunión ofrece interpretación simultánea en español, el botón Interpretación debería aparecer en la parte inferior de su pantalla, junto al botón Compartir pantalla. Haciendo clic en el botón Interpretación, puede elegir el idioma que desea escuchar. El botón Interpretación cambia entonces al idioma seleccionado. Para volver a cambiar el idioma que desea escuchar, siga el procedimiento anterior pulsando el mismo botón. Por defecto, oirás el idioma seleccionado a un 80% de volumen y el audio original a un 20%. Si quieres silenciar o desilenciar el audio original, haz clic en la opción correspondiente del botón de idioma. Disfruta de su reunión. Bien.
Hello, everyone. Feel free to introduce yourself and share your comments during the webinar by clicking in the chat. If you have questions, please use the Q&A button. Over to you, Daniela.
I have the pleasure of introducing our first speaker today, Neha Mankani, a colleague from ICM and midwife from Pakistan, who was nominated to the BBC list of 100 women for her incredible work on working with climate-affected communities in Pakistan. Neha, over to you.
Thank you so much, Daniela. Welcome everyone, and it's so exciting to see how many people are here. I find these IDM events and very electrifying to see so many midwives from all over the world. It's a really exciting day. So very happy International Day of the Midwife to all of us. This year, the theme resonates very deeply with me, which, as we know, is Midwives, a Vital Climate Solution. So midwives, as we know, are champions of maternal and newborn health, and rightfully so, but their impact extends far beyond. So they play a crucial role in building sustainable healthcare systems and are at the intersection of healthcare and climate resilience. The midwifery model of care, as we know, is inherently environmentally friendly. Midwives prioritize natural birth processes, minimizing unnecessary interventions that generate waste. Their focus on holistic care empowers women, leading to healthier families and communities. Ultimately, strengthening resilience against the impacts of climate change, which we learn more about today. Based on our experiences and those of midwives that ICM has been working with globally, we're seeing the evidence of the impact on maternal and newborn health of climate change. And with it, we are seeing midwives who are able and willing to provide a full range of services through community and facility-based care. When we see climate disasters, we also see midwives carry out their role as first responders and really minimize the loss of continuity of care and displacement. So today, let's celebrate the incredible work midwives are already doing. They advocate for informed choices, reduce reliance on resource-intensive interventions, promote breastfeeding, powerful active climate action. And today we'll be hearing from some amazing midwives from around the world who are first responders to this crisis through their work in climate emergencies and climate-affected communities, as well as research, advocacy, and sustainable midwifery practice. The film that we'll be screening today is about my work in climate disasters and climate-affected communities in Pakistan. This film really wonderfully captures the role of midwives as a climate solution, but also, I think, really gets us thinking about how, as we celebrate these midwives, we need to acknowledge that to truly unlock their full potential, we need to have an enabling environment to work in. For this means we need increased investment and funding for midwifery services and education. We need to equip midwives with the tools and infrastructure they need to provide high quality, sustainable care. Midwives need to have autonomy and greater decision-making power within healthcare systems, and really support midwives to have a seat at the table and to be included in discussions and policy-making processes that shape maternal and newborn health outcomes, which is what they do. So by supporting midwives, we invest in a healthier planet, stronger communities, and sustainability. I really look forward to hearing and being inspired by all our climate heroines today. And I hope that this film that we are starting with resonates with you. The floods that you'll see and hear about today in Pakistan, their aftermath was a deeply personal learning experience for me, which I'm so happy that I can now share with other midwives. So thank you again for being here.
Film inspires us every time we see it. Thank you so much, Neha, for making it, for telling your story, and for ensuring and just inspiring everybody with the amazing work that you do. And ultimately, thank you for helping the communities that you help in Pakistan. I am honored to introduce our other speakers today. After seeing this amazing documentary where we saw the impact of midwives as first responders and guardians of sexual, reproductive, maternal, and newborn health, even when the worst impacts of climate change strike, we look to the people who are helping. And who is helping? Midwives are often the ones helping. Today, we have 6 midwives with us from all around the world who will each share the work they're doing towards addressing or preventing the impacts of climate change in their communities. Let's take a moment to celebrate their work, and may their stories inspire all of us to take action in our own communities. Today, with us, we have Penina Chichoncho from Uganda, Laura Weil from the United States of America, Kanata Akhtar from Bangladesh, Jacqueline Mukuri Jeru from Kenya, Josephine Frame from the United Kingdom, and Macarena Martinez from Chile. Penina, would you like to begin?
Thank you, Daniela, once again. I'm Penina Chichoncho. I'm from Uganda. I'm a practicing midwife. I'm a climate change activist. I'm a sexual reproductive health advocate. And I've been able to work on a project of climate change, looking at the impact of climate crisis on pregnant mothers and postpartum mothers in one of the regions from the Western Uganda that was hit by floods. And part of the ICM working group on indigenous midwifery. So here, I support midwives, I love midwifery, and I do it with passion. So Uganda has been mostly a tropical climate characterized by rainfall and heavy patterns. However, the effect of climate change has turned around the seasons, and the country has experienced longer harsh droughts, landslides in the different regions of the country. And as a midwife has worked with different communities, I've been able to work and interact with health workers and leaders. And we have faced difficulty in tracking mothers, girls, and children because they are very vulnerable when these crises happen. And there has been less emphasis towards the response of these emergencies during climate crisis because of lack of policy and lack of resilient health structures in place to support the sexual and reproductive health rights. So while the affected people, our mothers, seek for refuge, shelter, we are not able to follow them up. I remember one scenario that chokes with emotion when I came across a mother was putting up in a primary school. That's where they had placed them to be. And she could not be able to access the health services. And one of the emotional statements she mentioned, she was like, her food stuff was also washed away with heavy rainfall and the landslide, so she could not even eat what she really wanted. And that was so heartbreaking. And she was 34 weeks pregnant. So she could not even access privacy. But how best have I tried to come up and address these challenges? I've worked on mothers one-on-one in these facilities, and it has been most a difficult time because even in our facilities, we don't have equipment to use. So it becomes a challenge for us amid these emergencies. Impassable roads, we cannot even access where we want to go because of the destruction of roads. And I come up now to focus on midwives and ask ourselves, what best can I do better to provide the sexual reproductive health services like family planning, treatment of communicable diseases, help our mothers carry out timely antenatal, and all these keep on coming into my mind. And I'm glad that ICM this time has identified us, the midwives, as a vital solution, as a vital climate solution. And this will help us delve deeper into being part of the mitigation, adaptation, and creating resilient systems in our countries. And I'm happy that midwives all over the globe, they are here listening to us. So I'm here to advocate for climate change by developing action plans, because as a midwife, I know I'm uniquely positioned to reach out the affected communities. And I've done that here in Uganda, and I've directly worked with communities, and we've seen an impact. Most of us midwives, we do these things, but we don't even know that we are helping. We didn't know that we're even tackling climate change. So therefore, I look forward to creating an effective network through which information can be distributed to the concerned partners, especially the ICM, which is the main partner, our midwifery associations, that we can work together in addressing the effect of climate change on sexual and reproductive health. Then another thing, educating. I've tried educating and empowering women, which has shown a very positive impact on both reproductive health outcomes. These are small things like providing water at the facilities for drinking, teaching them on what to do during these crises, saving food for themselves, and also having a sustainable environment. So I look forward to being part of the policies, doing research, and also other innovations. And I call upon midwives all over the globe that we can do this. We can be change makers and we can impact women's lives globally and they have a beautiful outcome. Thank you.
Thank you, Penina. And you're right, midwives belong at every preparedness and decision-making table. I'd like to now give the floor to Laura Weil from the United States.
Thank you so much. And Penina, such an inspiring talk. Thank you so much. I'm very excited to be here with you. I am Laura Weil, a midwife from University of California in San Francisco. We have been experiencing significant wildfires in California. So I wanted to start just about how personal this discussion is for me. The photograph on the left is outside of my home in September of 2020. So this is midday during the wildfires that came through in 2020. The skies turned bright orange. It had this very apocalyptic feel. It was dark and just terrifying. I panicked and called my brother in New York City and asked if I could send my children, who were older teenagers at the time, to stay with him while the air quality was so poor and it seemed so frightening and evacuation was looming. He told me I was probably overreacting. He would take the kids, but don't worry, it will all be fine. 3 years later, the picture on the right is from my brother's shop in Brooklyn, New York. You can see through the window the same orange glow that they experienced when the Canadian wildfires sent smoke down to New York City and blanketed about a third of the United States with poor air quality. It was a very personal moment to realize that in terms of climate change, there is nowhere to run. We cannot run from the wildfires and the changes to our planet. So we simply have to adapt. California's wildfires are becoming more extreme. Over the last 2 years, both the US and Canada have experienced the most wildfires in their entire histories. There's been a doubling of the incidents since 1984. Millions and millions of acres of boreal forests have burned. And in fact, in California, the top 20 largest wildfires in our entire history, 8 of them have happened in the last 4 years. So the incidence is really increasing dramatically as we speak. Hospitals are directly affected. So this is a hospital about 3 hours north of me. It was the Feather River Hospital. It actually burned completely to the ground. So services were completely disrupted. Patients had nowhere to access care and had to be evacuated to other facilities. So we had to receive some of their patients. We had to make sure that records were received, that care was not disrupted. And evacuation plans have to be made now for our hospitals in ways that we've never had to do before. At UCSF, we've been doing some research on placentas and looking at the actual physiologic effects of our wildfires on our pregnant patients. So we've been collecting placentas from exposed patients and non-exposed patients for several years now, looking for markers of inflammation, oxidative stress, endocrine disruptors, some epigenetic changes, and endothelial damage. These photos are from some of our placentas. So in these photos, you can see the CD68 cells or Hofbauer cells. These are placenta-specific macrophages. In the non-exposed placentas, they immunofluoresce as green. So you can see a high concentration of the green Hofbauer cells in the non-exposed placenta and a significantly decreased number of Hofbauer cells in the exposed placenta. And this is just one of the markers that we're seeing of placental damage from wildfire exposure. What was interesting to me is as I collected placentas for research, nearly every single patient I approached asking for them to donate their placenta agreed. Our patients are extremely concerned about this exposure and what their effects on their health will be. It was much higher than our normal uptake for our studies when we approach patients. So we've been working specifically with our patients to be able to assess air quality in their area when they are pregnant. There are apps, several apps on the phone that are sponsored by our government regulatory agencies. It's also now part of the iPhone and the Android phone that you can assess daily air quality. So we have this marker where patients can really look to see what their exposure will be on a day-to-day basis. Once our patients reach the orange level, we start to ask them to make adaptive measures in terms of using air purifiers in their homes, closing windows and doors, using masks when they're outside, decreasing their physical activity and their exposure. And then we really have been working to make specific wildfire plans with our patients so that they know at what air quality level they need to make interventions. They know how to assess for fire risk and evacuation plans, that they have air filters. One of the things we found is that our patients who actually use the air filters during wildfire incidents were patients who already had them on site. So working with patients in a proactive way to make sure that they have access to air purifiers. Knowing where they would go, having an evacuation plan, and knowing which of our patients aren't able to evacuate and making sure that they have access to our emergency services if they need to stay in place and shelter in place. So it's a very minor start to help our patients manage the wildfires and their air quality, but it is something. And we need to really work as midwives in our legislative bodies to work to decrease our fossil fuel consumption, really mitigate the effects of climate change, and be advocates for our planet as well as our patients. I'm so inspired to be here with midwives from all over the world who are working in the same vein. Thank you so much.
Thank you, Laura. The amount of wildfires is increasing all around the world, and I think that many of the indicators that you've shown will be useful to others as well. Next, we have Kanata Akhtar from Bangladesh. The floor is yours.
Thank you very much. Assalamu alaikum and good afternoon from Bangladesh. And this is Kanata Akhtar, and a professional registered midwife, working as a midwife coordinator at Hope Foundation for Women and Children of Bangladesh. Happy IDM to all the midwives around the world and those who are working for the midwives and the midwifery. I'm truly honored to be here today with all other incredible panelists. Am I audible now?
Okay. We can hear you.
Okay, thank you very much. Today in this event, I want to focus only on breastfeeding, rather unnecessary formula feeding. And for this, in the beginning, I just want to share some of the lines from one of the research and published in International Breastfeeding Journal. And it is like, for the formula feeding, we need the mass production from the industry with plastic and other waste and degradation of land and waterways. And each kilogram of formula milk generated 4 kg of greenhouse gases during production, mass of this from unnecessary formula feeding or the toddler formula. And also recent research reveals that if looking at the full product's life cycle, consumer use carbon greenhouse gases emission per kg are actually 3 times higher than the pioneering estimation. Single-use plastic bottle, nipple, and also the caps used in formula feeding contribute to plastic pollution in oceans and the landfills, negatively impacting marine life and ecosystem. Production, transportation, and disposal of these items contribute to resource consumption and pollution. Only 4 months of formula feeding with infants formula compared to the breastfeeding, it's resulted 38% higher global warming. And the million of babies, 2/3 globally, now have the formula feeding along with the breastfeeding. 1/3 of the women are reported they got suggestion from the healthcare provider with specific brand. And also research shows this. The healthcare provider are also influencing by the industrious people by attractive gifts, the funding for the research, and also events payment. from a groundbreaking study in 2016 showed that emission of unnecessary formula milk from just 6 Asia Pacific countries equivalent to 6 million of car travel. And environmental health and harms combined with economic evidence highlights that place for a strong public health response on this issue. And from my 6 years of experience as a midwife in different positions, what I saw many women actually suffer for the breastfeeding in various reasons. And what I realized, the primary solution for this problem is to have a educational session and the support from the midwife, just for 10 minutes to teach them good positioning and attachment of the breastfeeding, and further is going to mastitis and so many problems. And also they are suffering physically, mentally, economically, and financially also to feed their babies formula feeding. As I mentioned before, working as a mentor at my organization, I ensure and ask to my midwives team to teach each and every midwives about the good positioning and attachment of the breastfeeding, and also to help them on breastfeeding. And also we are ensuring the family education on breastfeeding and asking them also to support the mother during their breastfeeding period. And we have some plan to work on it through my social platform, in person and with team in my country and in the community level. I'm sure each and every midwives are trained on breastfeeding support, and inviting today all of the midwives around the world to take and invest just your 10 minutes. I would say just a 10 minutes project. And what I practically experienced is it needs only 10 minutes to teach a woman the breastfeeding position and attachment, and to ensure them the baby is feeding. And you will find a very, very happy face of the mother and the family members. Formula feeding sometimes it's life-saving, we know and we believe that, because those women who have really serious health issue and the baby who have the problem, they need those formula. Like women, those who are taking the chemotherapy and others the medicine. And besides that, we also know the importance of breastfeeding for the women. It's life-saving, and earlier it help for the prevention of the PPAs, and in later in life also it can help as a prevention of the reproductive organs cancer. And we know much of also have the facilities, have the breastfeeding, and also for the babies works as vaccine. It's also help to have the good bonding with the mother and the baby, and most importantly, it helps the women for the to relieve the postpartum depression and postpartum stress. That's a very, very important point. And as midwife, we can also take some steps in our community level. We can start from the zero. We can teach a women in the community and ask them to teach the women who are next to them, to teach the family, because this is very, very efficient and cost-effective system to change the society. And I'm requesting also all the NGOs, stakeholders, and the people who are on the table, please include midwives for the climate action, because midwives are the true resource, I believe. We have the 100 of opportunities to work on the women's health, on their reproductive health, which are affecting now the climate resilience. So
Thank you.
I'm
Thank you,
also
Pranata. Quickly, if we can wrap up.
Yes, lastly, I just want to say one line: invest your 10 minutes and complete a happy breastfeeding project and give a priceless gift to the women, family, babies, and the planet. Thank you.
Thank you, Pranata. You're right. Breastfeeding is so important all the time, but especially in light of the climate crisis. Next, I'd like to give the floor to Jacqueline Mukiri Jeru from Kenya.
Thank you, Daniela. My name is Jacqueline Mukiri Njeru. I am a midwife specialist based in Kenya, specifically in Nyeri County. I am also the founder of an organization by the name Holistic Family Midwife, where we deal with women holistically. I'm grateful for this chance. The burden of climate change in Kenya, specifically on maternal and child health. In Kenya, we have freshly come from the issue of drought and also extreme heat, whereby we have hit very high extreme temperatures, and they're currently dealing with floods. So we have had no break from the effects of climate change issues. And so what has been the impact of these climate change issues to Kenya? Currently, Kenya has experienced, some areas have experienced food shortages, others have experienced drought, that is diseases that have been caused by extreme heat and change of temperatures in areas. And that means that some counties have experienced diseases that were not there before. They have become now endemic in the places. And then we have issues of illnesses, other illnesses like respiratory illnesses, and people lacking ways to sort this out. So the role that we are playing as midwives to handle this, because we can see this on maternal health, there are important points to a midwife, whereby you need to enable women to overcome in terms of the outcomes, bad outcomes for both the women and the children. So myself with my group of midwives, as a holistic family midwives, what we are doing is number one, to educate the women, because we use the health belief model, whereby clients and people are usually listen to what they feel will impact their health positively. So we have educated the clients on areas such as planting foods that can be able to thrive in their areas, irrespective of their, maybe the climate conditions. Foods like cassavas and yams, those are foods that are able to thrive even in areas that are dry. And also on the issues of diseases migration, so we deal with the specific vectors, whereby we educate the women on having mosquito nets around their places. That is using a mosquito net as long as you're pregnant, and also for the families. And then the other thing that we are doing, it includes sometimes donating some items to them. That is like water bottles for rehydration. We know that with extreme heat and pregnancy, they do not go well together. So we give them some bottles and also educate them on how they can use water efficiently in terms of sparing some water and using water the way it should be used. The other thing that we do for those who are now living in flooded areas, because now floods are the issues we are dealing with, we are educating and sensitizing these women on how they can be able to, number one, move to areas, if possible, where they are less susceptible to floods. The second thing is to also educate them on the early signs of labor, so that these women can be able to move, to be able to get nearer to the hospitals when they are near to delivery. So this one has helped the women, and so far the clients and the people we have dealt with have been able to comply. So on the issue of carbon emissions, it is also the role of a midwife to help in reducing carbon emissions. So what are we doing? Number one, we were able to come up with a software whereby clients can be able to log themselves in, that is self-enroll themselves, and then they are attached to a midwife who can take care of them from home. This means we want to reduce the number of antenatal clinics, whereby a clinic that may not require some laboratory or radiological investigations can be done at home, or can be done online. This one reduces their traveling and also reducing carbon emissions as well. The other thing that we are advocating for, which our government, that is the government that is close to us, has really cooperated, is the issue of bringing up solar-empowered maternities. And this one is with consulting from our government. They are ready to start this soonest possible. They are just organizing their funds on so that we can have solar-powered maternity clinics and maternity hospitals. So also we have had to train the mothers in groups. When you train them in groups, we are able to reduce their movements. So a midwife goes to a group of women and their families and trains them as a group. And this one has helped them to be able to work things together. We form also a WhatsApp group whereby they are able to share to share their issues together. And this one has reduced anxiety and the stress that comes in from the issues that are there when it is mixed with the maybe lack of knowledge and lack of company for mothers mentoring each other. So forming the groups has been of such great help. The other thing we are doing is now for online, those who are able to Google things online. It has been researched and found that people love looking for information from the internet. So we came up with a YouTube channel whereby we train mothers and women and their families and even their spouses. As we are holistic, we train each and every one of them on their role in pregnancy, breastfeeding, and anything that they need to do. So we call upon our fellow midwives with this summary of what we are doing. We call upon our fellow midwives to take your strength, encourage yourself. What you are doing is good as long as it is helping someone. And we are happy to help our mothers and our families in Kenya to continue coping with pregnancy and parenting, and also to continue being healthy as a family. Thank you very much, and greetings from my midwives in Kenya. Bye.
Thank you very much, Jacqueline. I'd like to give the floor now to Josephine Frame from the United Kingdom.
Good morning, everybody. A pleasure to be here today amongst some inspirational women. So my personal interest in environmental sustainability was sparked as a student midwife when I was first introduced to low maintenance cloth nappies as an alternative to disposable nappies. And since then, I've always tried to make a conscious effort in my own practice to be less wasteful in care provisions. And even though the UK is anecdotally known as having a somewhat gloomy climate, even here we're seeing an increase in adverse weather events as a consequence of the climate crisis. We see blizzards, storms and floods during winter and heat waves, low-grade droughts, and we're starting to experience wildfires in summer months. And as anywhere in the world, these events impact our most vulnerable members of society most, those in poverty, women, children, and the global majority communities. As a G8 member, the UK has a responsibility to mitigate the emissions that we are making. And in 2020, the NHS, National Health Service here in the UK, was the first national system to commit to becoming net zero for all emissions by 2045. And this is now being embedded in legislation in our Health and Care Act, and work has been growing ever since. So in the early days, there was a lot of focus on estates aspects of the NHS, introducing greener energy provisions, improving waste management, for example. However, the impact of clinical care, along with the benefits of population health promotion in reducing pressures, has consistently grown since. In 2022, I was privileged to be the first midwife to be enrolled in the Chief Sustainability Officer's Clinical Fellowship. This gave me the opportunity to engage with existing sustainability projects around the country and inspire others to join this movement. During the fellowship, I was part of a small national team with 3 nurses, and with guidance of our deputy director, we developed a national programme of work to maximise the contribution and impact midwives and nurses are making towards net zero and sustainable greener healthcare. One of the first things we did was launch a sustainability network, bringing together passionate NHS nurses and midwives, giving them a platform to celebrate greener care provisions being initiated and led by our professions. And as mentioned earlier, we're often underrepresented in the sustainable healthcare circles. So I'm passionate about ensuring that we're giving opportunities to connect and learn from other midwives and nurses around the country, around the world, to support the growth and spread of greener care provisions and inspire change at all levels. We also collaborated on opportunities for personal development, such as green leadership programmes and spreading awareness of existing training opportunities to empower more midwives and nurses in the sustainable healthcare field. Wider, outside of our specific profession, and sustainable healthcare and greener practices is now being brought into national monitoring and regulation of the healthcare system as well. A lot of projects happening nationally consider streamlining services primarily for operational efficiency. And while ensuring patient safety and personal care is central, and where appropriate, exploring the potential of virtual appointments, for example, just as Jacqueline has explained, one project being self-monitoring of hypertension rather than weekly trips to a clinic. As women are often primary care providers in domestic settings, this means they don't have to think about the impact this may have on their family, getting childcare provisions, having to take their child to an appointment, the travel and transport, cost of public transport. They can do it at home with minimal impact on their need to take time away from the family or employment setting as well. And we know that the climate crisis exacerbates existing health inequalities and amplifies pre-existing health conditions. So here in the UK, we have a triennial report known as the Embrace Report, and this is the confidential inquiry into maternal mortality. The most recent report last year showed that after COVID-19, the biggest cause of maternal mortality was cardiac disease, one of the conditions that rising temperatures, heat waves, worsening air quality contributes to. So this demonstrates that the climate crisis is exacerbating existing health conditions, even here in the UK, in all societies, regardless of deprivation levels on a national scale. I've been using my platform to, similar to my peers here today, to educate midwives on how the climate crisis is affecting. Excuse me a moment, my son is being very...
Take him. I was just going to say, you can take him if you like. It's absolutely fine.
Sander, darling, just need to be a little quieter, please. I have bribed him with a sweet treat after this. So this demonstrates that the climate crisis is exacerbating existing health conditions, and with the additional healthcare risks this is compounded with adverse climate effects. So the climate crisis is affecting fertility, embryonic and fetal development. For example, the discovery of microplastics in placental tissue is going to affect the efficiency of placental function.
Yeah, Josephine, can we just wrap up?
Yeah, and with increasing risks of complex care needs, fetal growth restriction, preterm birth, how this can lead to more neonatal admissions, how this results in early mother-infant separation, and the impact that this can have on bonding, mental health, establishing breastfeeding, the health implications this can have in the neonatal period and in later childhood. So as midwives, we know we have the privilege in supporting the foundations of health for the next generation. So now it's important that we ensure that they have a safe, healthy environment in order to continue life as we know it.
Thank you, Josephine, and thank you to your toddler in the background. They were very good. I'd like to introduce our final speaker, Macarena Martinez from Chile.
Hola a todos, espero que estén teniendo muy buen día de la matrona. Mi nombre es Macarena Martínez, soy matrona, soy profesora asistente del Departamento de Promoción de la Salud de la Mujer de la Universidad de Chile, y para mí es un gusto y un privilegio estar ante colegas tan destacadas. Creo que me toca la difícil misión de cerrar este evento hablando al final, y creo que lo que quiero permitirme es compartir algunas reflexiones sobre cómo ser matrona me llevó a este interés hacia trabajar para y por la crisis climática. En el 2010 estaba terminando mis estudios de obstetricia y tuvimos un terremoto en nuestro país. Eso afectó muchísimo la continuidad del cuidado y la continuidad de la atención, lo que hacía y hizo ponerme perspectiva hacia el cuidado en emergencias y desastres, pero siempre considerando una perspectiva de género, porque en general cuando tenemos emergencias y desastres pasamos por alto cosas esenciales como la salud menstrual, la atención prenatal y los servicios reproductivos. Obviamente esas necesidades no se detienen durante una crisis, sino que se hacen más intensas y suelen desaparecer en emergencias y catástrofes, como muchas otras cosas. Si bien los terremotos no están directamente relacionados con la crisis que vivimos el día de hoy, los incendios forestales, como explicaba Laura, son un ejemplo de la realidad que vivimos ahora. Si estamos en medio del humo, incendios que hemos tenido acá en Chile recientemente, hay un humo espeso, hay llamas, ¿cierto? Hay llamadas de ayuda también hacia las matronas. y en ese momento, más que cuidadoras, también nos transformamos en personas que salvamos vidas, que buscamos garantizar la atención maternal y neonatal a pesar del caos que nos rodea. Si este ejemplo les parece un poco lejano, podemos pensar que muchos vivimos en las ciudades y nuestras ciudades en estos momentos se han convertido en islas de calor. em, Pocos espacios verdes donde poder desarrollar, ¿no es cierto? Y estas islas de calor efectivamente tienen efectos sobre la salud obstétrica y obviamente sobre la salud neonatal. Generan principalmente efectos adversos perinatales como la prematuridad, la mortalidad, el bajo peso al nacer, y esa es parte de donde yo intervengo. Si bien mi rol va un poco más allá del cuidado y yo hago investigación también, creo que hago esta investigación con la perspectiva que nos entrega ser matronas, amparadas bajo marcos de acción, ¿cierto? Coordinados, incluyendo la perspectiva de género, la visión que tenemos de la salud pública. Básicamente busco cambiar la acción política en mi país, transformar nuestro rol en un rol de activismo, de defensoras y de amplificación de la voz de las mujeres, en particular en salud. Si bien este trabajo pareciera ser netamente académico, también es un llamado a la acción para buscar y generar políticas basadas en la evidencia, con la inclusión de mujeres, con perspectiva de género y de los derechos sexuales y reproductivos, para que estos no se diluyan y no desaparezcan entre el humo y el calor cada vez que vivimos una nueva emergencia climática a la que tenemos que adaptar. Me encantaría profundizar un poco más en mi investigación, pero creo que esta historia no es mi historia particular de resiliencia. Yo creo que quienes presentamos el día de hoy, nuestra resiliencia es estar aquí, hablando con ustedes, contándoles lo que estamos haciendo muchas matronas en el mundo, probablemente una representación pequeña de lo que muchas mujeres también están haciendo en Latinoamérica, de generar evidencia e invitándolas a participar en investigación, invitando a quienes son matronas a involucrarse en este proceso para que más colegas puedan seguir quizás haciendo lo mismo que Neha, teniendo suficiente evidencia para demostrar lo importante que somos. Así que también las invito a crear, a construir su propia historia de resiliencia climática. Muchas gracias, Daniela.
Thank you very much, Macarena, and thank you to all of our panelists today for being so inspiring and working so hard, even when it's really difficult, and even when all the odds are stacked against you. Thank you for being there for women. I would like to invite my colleagues to share a link in the chat to a survey that ICM is conducting with the organization called Human Rights Watch. And I'd like to invite all midwives present to participate in the survey to tell us about some of your work and some of your thoughts about midwifery and climate change. I'd also like to invite all of you to attend our second International Day of the Midwife event, which is happening on Monday. More information can be found on the ICM website. To close today, I'd like to introduce our Chief Midwife at ICM, Jacqueline Dunkley-Bent, who will give closing remarks.
Thank you, Daniela. Thank you for that introduction. As Daniela has said, my name's Jacqueline Dunkley-Bent and I'm the Chief Midwife at the ICM. I have been absolutely inspired listening to our key speakers today. What an inspiration they are. We've heard firsthand that pregnant women, babies and children face extreme health risks from climate disaster that need our urgent attention. We know all too well that the effects of climate events on maternal and child health have been neglected and, I understand, underreported and underestimated. We all know that we have much to do to ensure that climate change response plans in affected countries absolutely include the needs of women, newborns and their families. So thank you to our amazing speakers sharing their experiences of providing midwifery care at such perilous times. Their commitment to the work that they do, placing mums and babies at the centre of everything they do against a backdrop of extreme, you too, that regardless of the situation and the context, it's important to keep our eyes firmly fixed on women and babies, making a way where there seems to be no way, creating a path for the art of the possible, whilst maintaining a seat at the table where they can articulate, where we as midwives should be able to articulate the significance of integrating women, babies, their families into climate response plans. Remember, what you do as midwives ripples through generations. I'll never tire of saying that. Our contribution to climate change matters. Happy International Day of the Midwife.
Thank you for being with us, everybody. Happy International Day of the Midwife.